Does urodynamics help with pelvic floor dysfunction? Have you ever wondered how urodynamics relates to pelvic floor dysfunction? Urodynamics is a series of tests that measure how well the bladder, sphincters, and urethra store and releases urine. These tests are essential for evaluating bladder health, especially for conditions like overactive bladder and urinary incontinence. The main purpose of urodynamic testing is to give healthcare providers detailed information about urinary system function, which helps them make informed treatment decisions. Pelvic floor dysfunction is a condition where the muscles and connective tissues supporting pelvic organs do not function properly. This can lead to symptoms like urinary urgency, incontinence, and discomfort. While pelvic floor dysfunction mainly involves muscular and connective tissue issues, it can significantly affect bladder function. Physical therapy aimed at strengthening and relaxing the pelvic floor muscles is often the first treatment recommended. It's important to note that urodynamic testing is not primarily used to diagnose pelvic floor dysfunction. This condition is typically identified through clinical evaluations, patient history, and physical examinations, including palpation of the pelvic floor muscles. However, urodynamics can be beneficial in specific situations. For instance, when symptoms of pelvic floor dysfunction overlap with other bladder disorders, such as overactive bladder or bladder outlet obstruction, urodynamic testing can help clarify the underlying cause of urinary symptoms. This is especially important in complex cases where initial treatments are not effective. From a bladder health perspective, urodynamics is crucial in assessing bladder function before and after treatments. For patients with bladder cancer, particularly those who have had surgery or radiation, urodynamic testing can identify changes in bladder capacity, pressure, and emptying ability. This information is vital for guiding further management and improving quality of life. While urodynamic testing is not a treatment for pelvic floor dysfunction, it serves as a diagnostic tool that can help rule out other causes of urinary symptoms and guide appropriate therapy selection. In cases where pelvic floor dysfunction is suspected, a multidisciplinary approach is usually recommended. This may involve physical therapy, behavioral modifications, and sometimes medication. Urodynamics may be included in this process if there is uncertainty about the diagnosis, or if symptoms persist despite initial treatments. In summary, while urodynamics does not directly treat pelvic floor dysfunction, it can be a valuable tool in evaluating bladder function, especially in complex cases. For those concerned about bladder health or with a history of bladder cancer, urodynamic testing can provide essential insights and help guide personalized care. Always consult a healthcare professional for a thorough evaluation and tailored treatment plan.